Nursing is a professional discipline grounded in caring. As a discipline, it has a distinctive knowledge of its own enshrined within its philosophies, theories, and models. As a profession, it applies this knowledge to members of society for the betterment of their lives, as being grounded in caring. This unique nursing knowledge, also known as nursing science and its expression, aka nursing art, is appreciated as professional caring. And because the nurse is also a person with their own distinctive culture, historicity, and experience, this professional caring is always expressed and enshrined with elements of human caring, as caring expressions are always seen as gestalt. An amalgamation of professional and human caring, nursing actions are appreciated as both reflections of professional competence and human compassion. Within this system, ancillary knowledge, from adjunct sciences, humanities, and personal experience, is essential in the expression of nursing knowledge, as this ancillary knowledge takes the form by which nursing knowledge is realized and at the same time improves the understanding of human caring. The knowledge that the person is irreducible, unitary, and unpredictable, a nursing perspective from Rogerian science of unitary human being, for example, cannot be expressed in professional and clinical practice without the mastery of therapeutic communication, anatomy and physiology, psychology and other sciences, all of which is not nursing but ancillary to nursing. Nursing being a professional discipline necessitates not only the mastery of ancillary knowledge but must include proficiency in nursing knowledge as well. Educating future professional nurse clinicians therefore must reflect the nature of nursing as a professional discipline grounded in caring. Non-nursing courses, as sources of ancillary knowledge, must contribute towards the mastery of ways to express nursing knowledge as well as the understanding of human caring. The whole degree program, especially that of nursing courses, must be geared toward a singular goal: developing professional nurses as caring persons. As such, the three components of nursing courses, theoretical, laboratory, and clinical, must be aligned to realize the goal of the degree program. The theoretical component focuses on the mastery of knowledge. It educates the nurse on how to think through the perspective that is uniquely nursing, emanating from its distinctive disciplinary knowledge. The laboratory component prioritizes the expression of professional and human caring. It educates the nurse on how to perform actions that reflect the distinctive disciplinary knowledge through ancillary knowledge. The clinical component focuses on the application of the distinctive nursing knowledge facilitated by ancillary knowledge to members of society for the betterment of their lives. It educates nurses on how to act with other persons so that the other people are empowered to live their lives meaningfully, and the nurse is appreciated as a competent professional nurse and a compassionate, caring person. This system is scaffolded, thus it requires that the learner masters the previous component before proceeding to the next, as the knowledge that is not mastered cannot be fully expressed. In a scaffolded system, mastery is assessed as a terminal competency, thus it cannot be fragmented into parts. Further, the knowledge that is required to act as a nurse in the clinical necessitates a full grasp of the theoretical component, as the person is unitary and unpredictable. This liminality within nursing situations in the clinical is what makes nursing distinctive in its practice. For this reason, it is preferable to finish the theoretical and laboratory component of the course first before proceeding to clinical. Therefore, if students have not passed the theoretical component, they will not be able to express it in the laboratory or the clinical. If the students have passed the theoretical component yet did not pass the laboratory, they will not be able to express the knowledge safely, and thus should not proceed with the clinical until they have mastered both the theoretical and laboratory components. Students who are allowed to practice in the clinical without complete mastery of the requisite components will be a danger not only to other persons but also to themselves. Some may argue that there are students who are weak in theoretical but are good in clinical. This may have a figment of truth, as those students may be solely expressing human caring and not professional caring in the clinical, thus they are not acting as professional nurses but merely as caring persons. Or that the students are merely focusing on technical competencies as a stand-alone skill set rather than an expression of nursing knowledge, making them act more as technicians rather than professional nurse clinicians. These represent the dangers when learning in the clinical area is incidental rather than intentional. Although being a caring person and proficiency in technical skills are a few of the outcomes of the degree program, it is not its central goal. This is the reason why the clinical component of nursing education needs to be grounded in a nursing caring perspective. Within the scaffolded system, the clinical component expresses the amalgamation of all the other two components and is the one that students often relate as the nursing. If the emphasis of the clinical component of the curriculum is on task completion rather than the persons within the nursing situation, students will perceive nursing as a technical job rather than a professional discipline. The system devoid of theoretical grounding is always at risk of focusing on skill set rather than knowledge expression. Before the start of the clinical, students and instructors alike must be reminded of the goals of the nursing situation and align the clinical exposure outcomes to this. For example, the nursing situation as caring moment theory asserts that the goal of the nurse is to allow the self-empowerment of persons within nursing situations by ensuring that the nursing situation is appreciated as a caring moment. With this, the nurse does not willfully create the caring moment with the primary purpose of self-improvement, but rather the nurse achieves personal growth as an effect of facilitating the self-empowerment of the other person through nursing. Although we know that using persons as a means to an end is neither moral nor reflective of the inherent values of nursing, the clinical exposure outcomes, because of missing theoretical grounding, are oftentimes phrased to reflect these tendencies. What is written in the clinical exposure outcomes will be the default process and perspective of both the student and the instructor during the clinical duty. Interestingly, because of the lack of theoretical perspective, the language of the outcomes reflects the assumption that using the patient to practice is indispensable in building the competencies of the student. This makes the other person a mere tool for competency mastery within the nursing situation, rather than the reason for the situation's existence. A student changing the IV line purely for skill acquisition will find the nursing situation less caring compared to another student who changes the IV line as a deliberate response to the momentary concern of the co-person, allowing for the empowerment of the other. Both students will acquire the same skill set, but the former may find the nursing situation meaningless, while the latter might find it meaningful. The shared personhood and humanity were accentuated by the latter and missed by the former. Skill acquisition to be significantly imbibed necessitates knowledge not only of the skill process but also of the reason for its expression within the moment. Using the other person for the sole purpose of practicing one's skill will not make the student a better nurse, but rather make them a lesser person. The student's critical reflection and their continuous clarificatory conversation with their instructor on what transpired within nursing situations during clinical exposure are essential in immersing them in the unique perspective, acts of caring and patterns of knowing distinctive to the discipline of nursing. Instructors must emphasize that knowing persons, their momentary concerns and their context involves all the patterns of knowing empirics, aesthetics, ethics, and personal. In clinical practice, aesthetic knowing, a way of knowing realities that are not empirically observable, is fundamental but is often neglected. The default perspective of clinical exposure is heavily reliant on empirical knowing, to the detriment of the other patterns of knowing. To fully know a person within the moment, a deeper understanding of the situation beyond the surface is necessary, which aesthetic knowing provides. Thus, it must be an essential part of the clinical exposure outcomes. There must be a conscious and deliberate effort by the instructor to guide the student to transcend the empiric-centered knowing to a more unitary transformative perspective that gives equal emphasis and importance to various patterns of knowing. During moments of discourse in the clinical, critical reflective questions must be asked by the instructor to elucidate what the students had experienced and the meaning they ascribed to their experience, as well as ground the clinical exposure to a nursing caring perspective. Reflective questions may include, what was the call for nursing? How did we know what we know about the person and their momentary concern? In what ways does the patterns of knowing, such as aesthetic knowing, utilize to know the person within the moment? What is the best way and approach to nurse the person after knowing what matters most to them at this moment in time? And in what ways may we utilize our insight from the current nursing situation to nurse the next person better? The essence of the nursing situation is the relationship, the caring between, in which nursing is co-created. The primordial reason for its existence is the person being nursed rather than the professional nurse. The nursing situation is more about knowing the person through the patterns of knowing, such as empiric, aesthetic, ethics, and personal, rather than simply assessing and fixing the patient. The clinical component of nursing education should be about expressing nursing knowledge to make a difference in the lives of persons, rather than a checklist of ancillary skills that need to be performed.